The crash cart hit the wall first. Then came the voice. A parade ground roar that could have stripped paint off a destroyer's hull, and every nurse on Ward 9 of the St. Anne's Veterans Care Center in Sainte-Anne-de-Bellevue froze where they stood. I told you people to get me a real doctor, not some glorified pill counter in a costume. Vivian Tran set down the medication reconciliation forms she'd been working on since 6 that morning and looked at the charge nurse, Helene, across the station counter. Helene was already shaking her head, her reading glasses sliding down her nose. "That's General Hadley," Helene said quietly. "Brigadier General," retired Louis Hadley. "He's been here 4 days and he's already put 3 of my nurses in tears. What's his chart say?" Helene handed it over without being asked. Vivian read quickly. 71 years old. Advanced renal carcinoma, left kidney, post-surgical complications, following partial nephrectomy. Sepsis watch. Refusing oral hydration. Refusing the secondary IV line they needed to push his immunosuppressants through. Refusing, according to the nursing notes, which were getting increasingly blunt, almost everything. She flipped to the military service section out of habit. It was something she always read first. Before the diagnoses, before the medication lists. Old habit. Nobody on the floor ever understood why, but she'd stopped explaining. Her eyes moved down the column. Royal Canadian Regiment. Bosnia, 1994. Afghanistan, 2006 to 2007. Kandahar Province, Panjwayi District, Task Force Orion. Something in Vivian's chest went very still. She closed the chart, pressed the cover flat with her palm, the way you'd press a hand against a wound. "I'll take him," she said. Helene looked at her with the exhausted, grateful expression of a woman who had used up her last reserve of goodwill. "Vivian." He demanded a male nurse. He demanded a physician. He told Sylvain, our Sylvain, who has been doing this for 19 years, that he had the competence of a mall security guard. I know. Vivian was already pulling a fresh pair of gloves from the dispenser. Draw up the second saline bag and the immunosuppressant line. I'll be out in 20 minutes. She did not rush down the hallway. Vivian Tran did not rush anywhere. A quality that had unnerved supervisors throughout her career in multiple contexts, on multiple continents, in conditions that would have made rushing seem reasonable. She walked the pale green corridor of Ward 9 at a steady pace, the medication tray in her hands, her gray-green eyes reading the chart one more time as she moved. Room 916 was at the end of the hall. Through the narrow glass window, she could see him. Brigadier General, retired Louis Hadley, was sitting upright in the hospital bed with the posture of a man who had not permitted himself to slouch in 50 years. He was a big man, or had been. The illness had taken something from his frame, hollowed out his shoulders somewhat. But the architecture of how he held himself said clearly that he was not yet willing to admit it. Silver hair, cropped tight. A jaw like a clenched fist. His hospital gown was twisted awkwardly, and she could see the fading bruise at his left forearm, where someone had failed twice at a venipuncture he hadn't wanted in the first place. He was staring at the wall. Vivian pushed the door open and walked in. I already told the last one, Hadley said, not turning his head. I want to speak to the attending, not a nurse, not a resident, the attending physician. I want to discuss the competence level of this facility, and I want that conversation on the record. Dr. Okonkwo is in a complex dressing change down the hall, Vivian said, setting the tray on the overbed table. She'll be available in approximately 40 minutes. In the meantime, your creatinine came back at 4.2 this morning, which means your kidneys are not clearing the way they need to after surgery, which means we need a second IV access point now, not in 40 minutes. So I need your left arm, please." Hadley turned to look at her for the first time. He had the particular kind of stare that senior military officers develop over decades, not aggressive exactly, more like a sustained pressure, the gaze of a man accustomed to people flinching first. He looked at her. She looked back at him with the same comfortable steadiness she'd looked at everything with since she was 24 years old, and a mortar round had gone off close enough to rearrange the air around her helmet. "You're new," he said. "I transferred from the Pembroke General 3 months ago. You don't look old enough to have transferred from anywhere." "I'm 38, Vivian said, unrolling the tourniquet. "Your left arm, General." He didn't move. "Do you know who I am? Brigadier General, retired Lewis Hadley. Royal Canadian Regiment. 2 operational deployments." I read the chart. "Then you know I've spent 31 years dealing with people who know exactly what they're doing, and I have a fairly finely tuned ability to determine when someone does not." He gestured at the room with something like contempt. "This facility is understaffed, the nursing rotation is inconsistent, and the last person who attempted to place an IV in my arm had clearly not done it recently enough. I am not a teaching hospital exercise. I am a patient with a right to competent care, and if that requires me to be difficult about it, then I will be exactly as difficult as the situation demands." Vivian considered this. "You're right," she said. "The IV placement 2 days ago was poor. I can see the bruising. That was a difficult stick and it was rushed. I won't rush it." Hadley blinked. It was almost imperceptible. "Your left arm," she said again. There was a long pause. Then, slowly, with the controlled movements of a man in significant pain that he was categorically refusing to acknowledge, he extended his left arm across the bed rail. Vivian worked without narrating. She found the vein on the second visual pass. His peripheral access was complicated by mild dehydration and the tissue damage from before. Cleaned the site and placed the catheter with the quiet efficiency of someone who had done this in worse light, with less equipment, with considerably more noise in the background. She taped it down, connected the saline line, watched the drip rate, and wrote the time on the dressing in black marker. "There," she said. Hadley looked down at his arm. Something crossed his face that wasn't quite acknowledgement, but was adjacent to it. "You've done that before?" he said. "Many times? In a hospital?" She began tidying the tray. "Among other places." He watched her. The ward sounds filtered in from outside. A call bell, someone's television, the distant squeak of the medication cart, and the room was quiet in the particular way that rooms get quiet when 2 people are both waiting to see what happens next. "What does that mean?" he said. "It means I've worked in a few different settings." She picked up the tray. "I'll be back at 1400 to check the line. Dr. Okonkwo will come when she's available. If you need anything before then, use the call button." She was at the door when he said, "You're not from Pembroke." She stopped. "You're French," he said. "You said Okonkwo's name with a Quebec accent. Pembroke nurses usually go Anglophone all the way through when they're nervous. You're not nervous, and your French isn't Pembroke French. It's something else." Vivian stood with her hand on the doorframe for a moment. "I grew up in St. Hyacinthe," she said. "Good ear, General." She left before he could say anything else. By the following morning, the ward had reached a fragile equilibrium with Louis Hadley. He had not thrown anything. He had not reduced anyone else to tears. He had, according to the overnight nursing notes, slept poorly, refused his 00300 vitals check once, and then permitted it on the second attempt. And at some point in the pre-dawn hours had requested, not demanded, a glass of water. Progress, Helen said, was relative. Vivian was reviewing his morning blood work when she heard the raised voice again. Different in quality this time, less command and control fury. Something rougher underneath it, less composed. She was in the room in under a minute. The young resident, Dr. Beaumont, was standing near the door, holding a tablet computer, and looking like he genuinely wished to be somewhere else on Earth. Hadley was sitting up in bed, and his face was flushed, and his hands were gripping the bed rail. And he was saying something about Kandahar and about a report and about incompetence. But the words were coming out in the wrong order, fragmented, and Vivian recognized what she was looking at. She'd seen it before, many times in many rooms, on many different continents. "Dr. Beaumont," she said calmly, "can you give us a few minutes?" Beaumont was through the door before she finished the sentence. Vivian set her tablet down on the chair and walked to the window. She adjusted the blinds, not closing them entirely, just angling the light differently, softening the room. A small thing. It helped, sometimes. "General," she said. Hadley was breathing hard. His eyes were somewhere else. She could see the sweat at his temples despite the cool air. "They keep asking me about advance directives," he said. His voice was controlled again, but barely, and the control was costing him something. "Every morning, every shift change. Have you considered? Have you discussed? Have you thought about?" As if I haven't spent 31 years watching men decide in a fraction of a second what they were willing to die for. As if I need a 28-year-old with a clipboard to walk me through the concept of mortality. Vivian pulled the chair out from the corner and sat down, not at the foot of his bed, not standing near the door. The chair, close enough to be present, far enough to give him the space to keep his dignity intact. "They're required to ask," she said. "It doesn't mean they think you don't know. They don't know what I know." He closed his eyes briefly. When he opened them, they were clearer, but something raw was sitting directly behind them. "There were 22 men in my company in Panjwayi in 1 week. 1 week in August of 2006. I lost 4 of them." He said it the way people say things they have said to themselves 10,000 times in the dark. Not dramatically, just as a fact that has never stopped being a fact. "I know," Vivian said. Hadley looked at her sharply. "You know. You read it in a chart." "I read the deployment record," she said. "August 2006. Panjwayi District. Task Force Orion. You read it. That's different from knowing what it was." "Yes," Vivian said. "It is different." She stood up. She wasn't sure, later, that she'd made a decision exactly. It was more like something that had been sitting waiting for its moment, recognized the moment and moved. She walked to the foot of the bed. She reached up to her right sleeve, the one she always wore slightly longer than the left, year-round, even in July, and she pushed the fabric up above her elbow. "I was a Canadian Forces Health Services technician," she said. "Corpsman equivalent. I was attached to a Royal Canadian Regiment Infantry section in Kandahar province from March 2006, through to the end of the rotation." She held her arm toward the light. The tattoo was not decorative. Nobody who knew what they were looking at would have called it decorative. It was the caduceus of the medical services. But the wings were stylized into the sharp, abbreviated lines of a Forces Health Services emblem. And around the base, intertwined with the staff, were the maple leaf and the regimental colors of the Royal Canadian Regiment. The lettering below was not large, She'd never wanted it to be large. It read, Panjwayi, 2006. Below that, in smaller script that she'd added 2 years after she came home, 4 sets of initials, WD, T, B, A, M, C, F. Hadley stopped breathing. His eyes moved from the tattoo to her face and back to the tattoo. The color had left his face entirely. Those initials, he said. The words came out as barely more than sound. Warrant Officer William Desroches, Vivian said. Trooper Thierry Belanger. Private Alexander Moreau. She paused. Corporal Christopher Flynn. Hadley made a sound that wasn't a word. His right hand lifted from the bed rail and hovered in the air between them, the way hands do when the body doesn't know whether it's reaching towards something or holding something back. You were there, he said. I was the section medic on Desroches' call. Her voice stayed level. She had practiced keeping it level for 12 years. When the second IED detonated en route summit, I was 40 meters behind when the lead vehicle went up. Hadley closed his eyes. His face looked like something breaking very slowly under a great weight. I was the one who reached Flynn, Vivian continued. He was conscious when I got to him. He was asking about Desroches. I didn't tell him. I had his tourniquet on his leg, and I was talking him through his breathing, and I didn't tell him that Will was already gone because I needed him to stay with me, and he did stay with me. He stayed with me the whole way to the FOB. She stopped. He didn't make the medevac, she said finally. The room was completely silent. They told me it was an intelligence failure, Hadley said, his voice stripped down to something that had no rank left in it, just a man. Route Summit had been cleared the week before. The patrol route was approved. I approved it. His jaw moved. I sat in the review board and I listened to them explain that the insurgents had planted a secondary device after the initial sweep, and that the timing was essentially impossible to have predicted. And I nodded, and I signed off on the findings, and then I went back to the FOB, and I never told anyone that I had overridden the section commander's request for a route variance that morning. Vivian went very still. Belanger wanted to use Route Hyena, Hadley said. He thought Summit had been trafficked too heavily the previous 72 hours. Standard instinct. Good instinct. I looked at the map and the timeline, and I said no. We needed the section on the eastern checkpoint by 0930. Route Hyena added 40 minutes, and we were already behind. He opened his eyes. They were completely dry. That was somehow worse. I made a logistics decision. That's what killed them. Vivian looked at him for a long moment. I need you to hear me, she said. Hadley said nothing. I need you to actually hear this, General, not just let it pass through. She pulled her sleeve back down to her wrist. Because I have been carrying my version of that morning for 12 years, and I know what carrying it does to a person, and I am going to tell you something that I have never told anyone outside of a classified debrief. She moved to the side of the bed, not a clinical position, just a person standing near another person. After Flynn died, I went back to the vehicles, she said. I was doing secondary casualty assessment. There was a compound wall on the south side of the road, maybe 15 meters off the blast site. Part of it had been brought down by the concussion, and in the rubble of that wall, our interpreter, Safi, he was with us the whole rotation. Safi found a cache. Hadley's eyes came back to her face. ID components, Vivian said. Pressure plates, ammonium nitrate, enough wire and initiator material for 3 more devices. The kind of cache you build when you're planning to work a corridor over multiple days. Multiple routes. She leaned slightly forward. That cache was inside the outer wall of a compound that backed onto Route Hyena. The cardiac monitor beeped steadily in the silence that followed. If Belanger's section had been en route Hyena that morning, Vivian said, they would have driven past that compound while the insurgent cell was still actively building devices. The forensics team concluded, and this was in a supplemental report that went up to Task Force Command in October 2007, well after you'd rotated home, that the cell had been active on Hyena for at least 4 days. There was evidence they'd been burying components in the route shoulder. She held his gaze. Route Hyena would have been worse, she said. The report estimated a high probability of command wire detonation with the section in the kill zone. They were set up for it. They were ready. Summit was an opportunistic plant. One device, poorly positioned, probably rushed. Hyena was a prepared ambush. Her voice didn't waver. You made the logistics call that kept most of your section alive, General. I know that isn't what you've been telling yourself for 18 years, but that's what the evidence said. Louis Hadley, Brigadier General retired, Royal Canadian Regiment, 31 years of service, 2 operational deployments, and 4 decades of keeping himself held together through sheer unrelenting force of will, put his face in his hands. He didn't make a sound. His shoulders shook once, sharply, and then he breathed in, and then he shook again, and Vivian sat down on the edge of the chair and said nothing at all, because there was nothing to say, and she knew it. She had learned a long time ago that the most useful thing you could sometimes do for a person was be present without trying to fix anything. After a long time, his hands came down. His eyes were red. He didn't try to hide it. Safi, he said, is Safi. He came to Canada in 2010, Vivian said. He's in Ottawa. He runs a translation service. I got a Christmas card from him last year. Hadley made a sound that was almost a laugh. Almost. Good, he said. His voice was rough. That's good. The next 2 weeks on Ward 9 were, by the standards of the unit, unusual. General Hadley took his medication without complaint. He permitted the morning vitals on the first attempt. He said please to the dietary aide and thanked the housekeeping staff by name within 3 days of learning their names. He was not warm. Warmth was not, Vivian suspected, something that had ever come naturally to him, but he was scrupulously, almost formally courteous, in a way that felt like its own kind of apology. He and Vivian spoke most mornings during her chart review, sometimes about his treatment, sometimes about logistics, occasionally about nothing in particular. The weather over the St. Lawrence, a book he was reading, the relative merits of various field ration meals, a topic on which they had extensive shared opinions. He asked about her family once, carefully, and she told him about her mother in St. Hyacinthe and her brother who was an engineer in Vancouver, and left it there, and he did not press. He talked sometimes about the men, Desrochers and Belanger and Moreau and Flynn, not in the fragmented, overwhelmed way of the first days, but more deliberately, as though he was finally allowing himself to remember them as people rather than just as losses. Flynn had a daughter, he said one morning. She was 4 months old when he deployed. She'd be 18 now. 19, Vivian said. Her birthday is in March. Hadley looked at her. I kept in touch with his wife, Vivian said simply. For the first few years, she's in Kingston. She remarried. Good man. From what I understand, the daughter did well in school. Hadley was quiet for a moment. Do you know what her name is? The daughter. Marguerite, Vivian said. But everyone calls her Maggie. He nodded slowly, filed it away somewhere. On the Friday of the second week, Dr. Okonkwo came in with the imaging results and the blood work panel and delivered the news with the careful, compassionate directness that made her one of the best physicians Vivian had ever worked with. The cancer had not spread beyond the original surgical site. The renal function was improving. The sepsis markers were clear. He would need close monitoring and an oncology referral and significant lifestyle modification, but the immediate crisis had resolved, and discharge was possible by the following Wednesday. Hadley listened to all of this without interrupting. When Dr. Okonkwo finished, he thanked her precisely, and she left. He sat quietly for a moment. "Wednesday," he said. "Wednesday," Vivian confirmed. She was making a note in his chart. "I need to ask you something." She looked up. He was looking at his hands, which were resting in his lap. Large hands, scarred at the knuckles in the way that came from decades of doing physical things in unforgiving environments. Not the hands of a man who'd spent his career behind a desk. "The classified report," he said. "The supplemental findings." "Root hyena, yes. I've been trying to access that since 2008, he said. "Every official channel, FOI request, direct inquiry through regimental associations, through VAC. They told me the supplemental action review for that particular incident was sealed pending ongoing operational security considerations." Vivian set the chart down on the table. "It was declassified in 2019, she said. "The operational security consideration was a related network disruption that concluded in 2018. After that, the seal lifted automatically." She paused. "I found out in the fall of 2019. I had a contact at the Directorate of History and Heritage." Hadley looked at her steadily. "Why didn't you? How long have you known where I was?" "I didn't," she said. "I didn't know you were my patient until I read your chart on day one." She picked the chart back up. "I read the unit, the deployment window, the province. I put it together the same way you'd put together a grid reference." He was quiet. "I would have found a way to tell you," she said. "Even if it hadn't happened the way it happened. I want you to know that." She met his eyes. "You deserved to know. You should have known years ago. I'm sorry it took this long to get to you." Louis Hadley looked at her for a long time. Outside the window, the St. Lawrence was flat and gray in the November light, the kind of gray that looks cold but holds a certain quality of depth if you look at it long enough. "You were 19, he said. 22. Still." He shook his head slightly. 22 years old in Panjwayi in August 2006. I had boys in that section who shaved twice a week whether they needed to or not. "And you were the same as them," Vivian said. "Doing the same thing?" "Not the same thing. No," she agreed quietly. "Not exactly the same thing." The morning of discharge was bright, which felt like an editorial comment from the weather. Vivian was finishing her last chart notes before handing off to the afternoon rotation, when the charge nurse found her at the station. "There are people in the lobby," Helene said, with an expression that meant the situation was unusual but not alarming. Vivian came around the counter and walked down the corridor to the elevator, and when the doors opened on the main floor, she stopped. In the lobby of the Stians Veterans Care Center, arranged in a loose formation near the main entrance, were 7 people. They were in civilian clothes: jeans, winter jackets, work boots. Several of them were older, her age or beyond. One was in a motorized wheelchair. One was leaning on forearm crutches. All of them were standing or positioned with a posture that had nothing to do with civilian habits. She recognized the man closest to the door. It took her a moment because 18 years does something to a face. But then the set of the jaw, the particular way he tilted his head, and she had it. Warrant Officer Thierry Bélanger. Retired. The man who had wanted Root Hyena, He was watching her come toward them, and his expression was the complicated one of a person who has been carrying something heavy for a very long time and has just put it down. Louis Hadley was standing beside the information desk, coat on, discharge folder in hand, his hospital stay officially concluded. He looked better than he had 14 days ago, not well, not yet, but present in a way he hadn't been. His eyes found hers. "I made some phone calls," he said simply. She looked at the people in the lobby. Boulanger stepped forward first. "We heard what you found," he said. His voice was rough. He was struggling with something and not hiding it. About the cash, about Hyena. He shook his head. "We've been carrying that route for 18 years, Tran. Every one of us who was there that day. Thinking he made the wrong call. Thinking we should have pushed harder." "I should have pushed harder," said the man in the wheelchair. She placed him now, Private Doused from 2nd Platoon, different section. He'd been on the perimeter that day. He was looking at Hadley, not at her. "Sir, I've been angry at you for a long time. I'm sorry." Hadley said nothing. He nodded once, and it was the kind of nod that accepts something. Then Boulanger turned back to Vivian. "You went back into that," he said, after. "You went back to do the secondary assessment. You found it." "It was my job," she said. "It was more than your job." His voice was flat with emphasis. The way people speak when they want to make sure something registers past the polite deflections. "You were a 22-year-old health sur tech, and you went back into an active blast site to do your job. And you found something that could have cleared the general's name a decade ago if anyone had put the report in front of him. And you didn't stop looking until you found it." He stepped forward. The other veterans shifted in the same moment, some instinct or agreement between them without words. The kind of coordination that happens in people who have operated together and formed up in a loose line behind Boulanger. "We served under Task Force Orion and the Royal Canadian Regiment," Boulanger said formally, loudly enough that the lobby went quiet around them. The administrative staff at the reception desk had stopped what they were doing. A couple near the vending machines was watching. A younger woman with a child on her hip had paused near the main doors. "We are here to say, in front of witnesses, that Corporal..." He paused, glancing at her, checking, "Chief Petty Officer, 2nd Class, Vivian Tran, Canadian Forces Health Services, did not leave us in Kandahar. She brought us home, the ones she could reach." His jaw was tight. The ones she couldn't, she brought back in the only way left. She tried to speak. Couldn't. "Attention," Boulanger said quietly, "and the veterans of Task Force Orion. The men in winter jackets and work boots. The man in the motorized wheelchair who squared his shoulders and sat as straight as his injury would allow. The man on forearm crutches who planted them and lifted his chin, came to attention. And then they saluted. Louis Hadley saluted beside them. His arm was not at full extension, the surgery, the fatigue, but his hand was precise and his eyes were direct, and the salute was unmistakably exactly what it was. Not a formality, not a reflex, a reckoning. Vivian stood in the lobby of the Stan's Veterans Care Center, with tears running down her face, and raised her right hand and returned it. There are things that happen in a person's life that don't resolve cleanly into meaning, that stay ragged at the edges for years, that refuse to be made into a lesson or a story. Then there are rare moments when something that has been broken for a long time becomes not fixed exactly, but recognized, seen for what it actually was. And the weight of it doesn't disappear, but it shifts, distributes itself differently, becomes something that can be carried rather than something that carries you. That was what the lobby of a veterans' care home on a bright November morning looked like. That was what 12 years of not quite being home, and then finally being home, looked like.